as they used to say, good morning, America, good evening, Asia, and good afternoon, Europe. We are now in our last session of our European COVID Summit. I do apologize for some of the technical glitches that we've had, but when you least expect it, Mr. Murphy comes to visit with his laws. Could use a word that beep happens, and so it did this time around, but all of the recordings will be on our YouTube channel, and thanks for your patience and being with us. Without further ado, and without long introductions, because we will end at exactly past, I would like to introduce our next discussants, and I will do that in a very short fashion. In other words, we have with us Michelle Williams, professor and dean at Harvard University, or dean for Harvard School of Public Health. Welcome, William, and welcome, Michelle, and she's also the co-chair of our Resilience and Reform Commission. And secondly, we have with us my old friend and old colleague, among other things, former Foreign Minister of Singapore, George Yeo, who is also a member of our external advisory board at the School of Transnational Governance. Lovely to have you with us. Now, let's begin with Michelle. A very simple question, which is going to go to the two of you. What is your experience in the United States with COVID, and what is the situation right now?
Great, thank you. And good morning, good afternoon, good evening, I suppose, to all. Alex, thank you for that question. So let me try to be brief, and I'll just basically say, in a lot of ways, in the United States, we are still playing catch up. Since January, we have managed to mount a more robust response to this pandemic with the onboarding of President Biden and his team that he had put together to robustly address this pandemic. We are up to having over 4 million, approximately 3.5 to 4 million vaccinations a day, and that's really important. We are trying to outrun the spread of variants, which threaten us all. But I will say that the goal of trying to vaccinate a majority of the population to reach this goal of herd immunity is proving to be an enormous challenge, partly operational and partly related to the high proportion of vaccine hesitancy. It doesn't help that the recent news around the very rare, very infrequent cases of blood clotting disorders related to the AstraZeneca vaccine doesn't help us, because it slows down our opportunity to have access to vaccines, but also increases cause for concern for hesitancy. On the economic side, I will say that we are opening up our economy in a disjointed, uncoordinated way, and in parts of the country where we've swung the doors open too quickly, the virus has traveled with people re-entering civil society in ways where we're now seeing increasing spread in more than half the states, and most concerning in Michigan, where the positivity rate for the virus is upwards of 15 to 17%. So let me just stop there, but there are reasons for optimism with increasing vaccination rates. There are reasons for concern with the rapid spread of the variants in some corners. And I will say that it is hard in the North American space to say that we have one pandemic. The dynamics of the virus and the responses to the virus have been so variable that it's a case of, if you've seen one, you've seen one. There's not a coordinated, robust resilient, if you will, response that goes across the regions.
Yeah, thanks, Michelle. It's very interesting to hear, the view, because of course what we do in Europe and elsewhere, we're online, we follow the debate, the discussion. We've just had a good one on disinformation and what is going on. I think one of the things that we can conclude is that the virus is like the pandemic, both of them mutate. And they mutate in many different ways, politically, socially, from a health perspective, and we're all trying to grapple with this. And the question then, George, to you is, how is Asia grappling with all of this? Because of course the message that we hear here in Europe is that the Asians, they've done fantastically on this. No problems whatsoever. What's your take, George?
Singapore is a nice little bubble. I would say life is 70% back to normal, except for our international connections. And we are a tiny place, so we are, as it were, trapped in this little bubble. What is happening in other parts of East Asia is generally much better than in the West and in other parts of the world. But what is happening in China is like a different universe. It's a continental nation, and life there is 90% back to normal. They have concerts, they hold huge gatherings, trains are packed, domestic air travel is back to normal. And last year, despite COVID, they grew at 2.3%. And this year, they'll do comfortably over 8%. And the difference is, I would say, East Asian societies are generally more communitarian. There's no issue about wearing masks. And in fact, even before COVID, it's quite normal for individuals in Japan or Taiwan or Hong Kong to go to the office and wear a mask if they have a cough or a cold, and no one looks twice at the person. So the instincts are different. A crisis like this brings out the best and worst in us, and it's a test of social systems and how much we're prepared to sacrifice for a larger good. So we are seeing, I think, in the world today, quite a differential response to a common challenge.
Yeah, one of the things is I said earlier on in the crisis that, man, having studied for 4 years, and Michelle will love this, in Greenville, South Carolina, Furman University. So I thought, when you start restricting the freedoms of Joe Sixpack in Columbia, South Carolina, all hell is going to break loose. And it did in the beginning. You could see that there was a sentiment of, anti-mask, anti-virus, denial, and the rest of it. And may I just, if I can jump onto this, because, is the difference here that in the United States and Europe, it's all about individual freedom. Whereas in Asia, a lot of times it's about the collective thinking that, okay, I am willing to sacrifice my individual freedom and pool something into security. I think George first on this, because in Europe, masks were not a thing, and we would not like to be controlled in the way in which China sort of locked down. But obviously it worked, huh?
Well, so far, yes. But the problem now is, how do we open up to one another again? Yeah. If you are China, that's fine. But if you are Singapore, if we don't open up, we suffocate.
I know, and I come from a small country which is completely dependent on exports and trade as well. And of course, when the whole system breaks down, you run into trouble. How about Michelle? What was the sentiment? Of course, you had elections coming, and there were these sort of parallel truths going on, and all of this. How can you handle that?
Well, you foreshadowed two of the three responses that I'll share. First, I do believe that this attitude of collective response is always been part of the American character, to be, their own bootstraps. So that's one issue, that the spirit of collectivism isn't part of our inherent DNA. The second thing about that drives this quixotic response to mask wearing is, initially the information was very, very poorly brought forward to the public. The CDC was first against the mask wearing, and then later, as evidence became much more clear about the dynamics of the spread of the virus, did CDC have a clear voice about this. But thirdly, shamelessly, because of our political climate, the mask wearing, and now vaccines have become very politicized. And so you would find that people who identify as voting Republican were against the mask, anti-mask, for political, ideological reasons, even more so than the uncertainty of the quality of the science that initially brought forward questions about whether masks were important. And so it's also not unique that public health measures like mask wearing becomes politicized. There's been a long history of politicization of public health types of interventions and health promotion. So all three of these factors, the uncertainty of the science around masks early on, politicization, and then Mandel in his book, The Tyranny of Merit. The American spirit sort of is, we didn't build this, I built this individuality spirit complicates a public health response that where people are needed to work in a collective action, joint action kind of way.
Very and George, yeah, exactly. And George, in Asia, was there any of this questioning, or was it just, okay, boom, 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 this is what we're going to do, these are the measures we're going to take, basta?
I think it is difficult to generalize across Asia. Certainly trust as a social indicator, trust as a measure of social capital, that has come under severe test. For some countries, that trust level has gone up. In others, it's come down. And trust is trust into the collective, in your public health authorities, in the media, in government, trust in whether an airline has taken all precautions. So trust is not a big issue, and no one is going to reopen up without being assured that, well, I can trust a hub, I can trust a system, I can trust a vaccine, I can trust what the government tells me.
Yeah. How about, okay, if we then move on and we start looking at this, because obviously the resilience Reform and for Resilience Commission, what we're trying to do is to make reforms that make societies more resilient to these types of pandemics. And if we start from the premise that the pandemics have many different variants, and they will be with us for a longer time, what would be your, so to say, 3 key lessons for resilience? I mean, what are the measures that you need to take in order for a society, a given country, to be resilient in these types of situations, economically, socially, or from a health perspective? Michelle, do you want to go first?
Yeah, first and foremost, Alex, I think we have to recognize that at least in the US and in other places in the world, we have to look at how we have underinvested in our public health infrastructure and our workforce.
Yeah.
The US is shamelessly underinvested in public health infrastructure, to the tune of, it's estimated that only 3% of all of the funds we spend, and we spend more money than any other nation on health and healthcare, only 3% of that spending is allocated to public health. And that makes no sense when about 80% of the determinants of health are social determinants that are out of the actual primary healthcare system and into communities. It's estimated we need $4.5 billion added to the public health budget to really build a robust infrastructure and support a workforce that is needed to do all of the necessary surveillance and primary prevention types of work to create a healthier, more robust society. The other thing that we need to recognize is our public health institutions, like the WHO, have a massive mandate, but have been under-supported because of the political and economic structure around how we support an institution that has such a massive mandate. And even in the US, the Centers for Disease Control, its effectiveness to respond to man-made or natural disasters is largely a function of the support federal support that's provided. And so you have these massive global and federal institutions that have a mandate, but are not always well positioned to be nimble and responsive, to be resilient in the face of threats. And thirdly, I think we have to recognize that public health is too important for just the public sector to manage. We really need to think about a more interdisciplinary, cross-sector, multi-sectorial response to preserving, protecting, and promoting health and wellness of populations on scale. Because if there's anything that we learned from this pandemic is just how primarily important it is to have a robust public health infrastructure and workforce to keep our national security and economic security humming at the tune that we need to have it. So we have to see public health. We have to recognize that public health is a pillar of strategic investment economically and socially, and not just as a cost center. And if we learn anything from this pandemic, I think is we've got to see public health as an insurance policy, not as just an item on the ledger that's a cost.
Excellent. So invest in public sector infrastructure, work together internationally, keep on supporting organizations like the WHO, and remember that this is not only a public sector issue. How about you, George? What are your sort of 3 takeaways for resilience?
First, the moral dimension. How we behave in a crisis defines us. How people behave in a crisis will affect how they see each other for years to come. At a time when we were desperate, you only look after yourself and your family. I remember that, and I will take that into account. And it is not good times, but pathos, which forges human cultures. At a time like this, we cannot dispense with moral leadership. That when people are selfish, they be exposed as being selfish. That there is a group dimension to worry about, that people who are marginalized, who are poor, have got to be looked after. And there must be moral pressure on one another to do the right thing. So at a time like this, society is either weakened or strengthened morally. So to me, that is a key point. The second point is the honesty of communication. At a time like this, it is natural that there's confusion and mistakes are made. There's a diversity of views. But there's sometimes a tendency for leaders, because they want a specific outcome, to shade the truth, to lean on one argument against another. You do that, you lose credibility, and people stop believing you. And when in a society, no one knows whom to believe, then we have a big problem. So it's extremely important that there be honesty of communication, that bad news be presented as bad news, that when mistakes are made, admit it. Mistakes are made, but we're learning and we improve ourselves. And the third point, I think, is psychological preparedness, that we've got to live with this, that viruses and bacteria, they now travel at the speed of jet travel. And many doors are open. And perhaps we've reached the apogee of globalization. And increasingly now, globalization must be accompanied by the evolution of semi-permeable membranes, which separate communities, which separate airflows, which provide some degree of separateness between you and me, so that we are not immediately exposed to one another. That which connects is also that which infects. We are social, therefore we must be connected. But like biological organisms, like cells in the body, there are always membranes which permit good interchange, but build in an immunological system which prevents pathogenic infection. And we've got to live with this. It requires technical knowledge. It requires sophisticated construction of spaces, of how we control airflows in trains and buses, offices, restaurants, aeroplanes. It requires a certain mental preparedness. The more we're connected, the more we must be protected. It's like modern computer systems. The more you're connected to the internet, the more you need antiviral systems built in. And the two have got to move in co-evolution.
Yeah, what do you think of that, Michelle? What's your reaction to it?
I think that is so beautifully stated. And I like the analogy of how we are continually investing in cybersecurity. You can't just say, I've put in the antivirus and I'm done. It has to evolve. It has to evolve as the capacity of the integrity of the system you're trying to protect changes. So I really love that analogy. I also love the fact that George brought up the psychological, and I will add the mental health resilience here, because some will say, and I support this, that at the end of the day, maybe the biggest outcome that we will have, more enduring outcome we'll have of this pandemic, is the toll that the uncertainty, the anxiety that this pandemic has brought on our mental health and wellness. And so I want to just expand on that a bit, because we have to be very thoughtful and strategic about investing in supporting the mental health and wellness of population. The other thing about George's point is, if we've learned anything, it's how deeply interconnected and interdependent we are, and that the solutions will be as importantly, they'll need to be as diffuse and as equitably applied across regions as they've ever been before, because we now know exactly how interconnected we are physically, economically, just for the security of society. We have to find ways to coordinate and better protect across these porous boundaries.
Yeah, exactly. And I mean, go ahead, George.
I think it's also very sad in the developing world that many countries are discovering how selfish countries can be when they are faced with a challenge like this.
Yeah, I mean, interesting. If I try to bring in a little bit about the earlier conversation that we had, because of course we had, among others, Jose Manuel Barroso, who is the president right now of Gavi, and of course doing a lot of the COVAX work. And he was telling me in our conversation that the aim of Gavi is to distribute 2.3 billion doses to 92 developing countries around the world. And here we come into the discussion that we had after that on disinformation and communication. How do you do this? So very few people know that the biggest sort of vaccine exporter at this particular time is actually the European Union. It surpassed 100 million doses of exports last year. Now, again, is this enough? Probably not. But the whole idea here in the conversation is to say, no one is safe until everyone is safe. And that's the mentality that political leaders should have. And one of the conversations we had as well was to say that all political leaders will be judged on 3 criteria: number of fatalities, rollout of vaccines, and then finally recovery of the economy. Now, what's a political leader going to do? He or she is going to focus on the area that he or she is best in. So if you screwed up in the beginning, you forget the deaths. If you're doing well on the vaccines, you say, look, we're ahead of the rest. And if your economy is recovering, you say, wow, look how we got out of this together. I think the mental health point is extremely important. That's something that the previous panel dealt with as well. For instance, Timo Lappi, who had a lot of data on how we've been affected by this. I mean, working, smart working or teleworking might be fun for a little while, but at some stage, it does get a bit lonely. There's nothing that we can do about that. Now, here's a sort of final round of questions, I guess, and that's the sort of, and Michelle, you touched upon it in the beginning, as did you, George. Who is who are the players? Who is responsible? Because quite often we get into this ideological debate that this is a public sector thing. I said, no, the markets will do this. I mean, is it the countries? Is it the regions? Is it the companies? Or is it all of the above? Should I start with George this time around? Who should be doing this?
Well, I would build from from myself. If the person is responsible, he will look after the family. If the family is responsible, the village will be looked after. Then the country. I don't think the solutions for a challenge like this can come from the big to the small. It must emerge from the small to the big. But the big must reinforce the small. Without the small, policies on the big cannot work. And I like very much Michelle's point that this is a very cruel virus. It's not very dangerous compared to SARS or Ebola or smallpox. But it stops something which is so quintessential to being a human being, which is our sociality and our ability to interact and to emote with our parents and grandparents. The virus prevents us from being emotional towards one another. We cover our faces and we can't read each other. So the psychological dimension of this pandemic, to me, is much more serious than the actual deaths that it causes. And we must address this. I mean, there's so much harm done to individuals and to relationships. And I don't think they are fully analyzed or even reported on.
I think that's an interesting and good way of bringing it about as well. And the question is, do we go back to the type of a social life that we used to have, an interaction? Of course, I'm a Finn, and if I'm allowed to a little bit joke here, you know what the reaction in Finland was when people said 2 meters social distancing? Why do we have to be so close to each other? But we all have different cultures, so it is what it is. But Michelle, what do you think? I mean, I like the way in which George framed it to go from the small to the big. So basically, individual responsibility and then back up from the big players.
I completely agree, actually. I completely agree. It has to start with the individual, the family, the community, the state, the country, the region. It's this layered response, and it has to be layered because of the very strong behavioral component that is a fundamental part for building resilience against a pandemic or against threats that are, name your other threats, climate change, etc. But there has to be a recognition that there is a top-down type of role here too, and that has to be surveillance. That has to be coordinated, thoughtful reporting of evidence based on science, not on ideology. And then there must be a coordinated response, having resources stocked away. Shamelessly in the US, we did not have fundamental supplies. We did not have the stockpile of medicines, of personal protective equipment, or a plan to strategically distribute them in an equitable way. So it really has to be that full chain of responsibility with very clear coordinated responsibility in communication, management, and surveillance at a national and regional level that rolls up then to global cooperation and collaboration. And so it is all of the above. It is very challenging. It is not one solution, one and done. It requires the discipline of continued effort in monitoring and preparing responses for this pandemic and the next one. And we have an opportunity to learn from the painful lessons that we've all experienced in the last 13 months.
I think this is a very good point to end on. And what brings to mind and sort of sums up everything that we've discussed is that we have now had a global collective experience about a pandemic and what it means to us individually, what it means to our families, to our communities, to our regions, states, and countries. And I think that experience will live with us for a long time. Of course, it has been asymmetric, some people have died, others haven't. There have been economic hits, social hits, etc., etc. But perhaps this is a sort of, how do I say, global alarm clock that we need to start caring about each other, that we need to take care of ourselves, that we need to find common solutions. Now, what we are going to do in our work in the Commission, Reform for Resilience, is to have takeaways from the seminar and discussion summit that we've had here today. We'll keep on collecting evidence, and we'll do an interim report for the G7 meeting this summer in the UK. And we will also do a memo of these discussions that we've had. I would like to personally thank you, Michelle and George, for being in our last panel. I would like to thank our audience and once again apologize for the technical problems that we had. But that's what happens sometimes in these kinds of situations. It's been a lovely day for us at the School of Transnational Governance, and we wish everyone a good morning, good afternoon, and good evening. Thank you very much.